Good evening, everyone. So I'm just going to introduce each of our speakers, and starting with our first speaker. So Zohra is an Associate Professor and NHMRC Emerging Leader Fellow. She's a trained epidemiologist recognised internationally for her work identifying interventions for improving reproductive, maternal, newborn, child and adolescent health and nutrition in disadvantaged settings by advancing knowledge in public health practice and translation into global health policies and guidelines. She has published over 200 peer-reviewed papers, which is 200 more than me, and is an author of 11 books and book chapters and several research technical reports. Her research has contributed significantly to global maternal and newborn policies, particularly her work with community health workers and outreach services has contributed significantly to global integrated maternal and newborn outreach guidelines. Her work with the WHO and PMNCH in developing consensus-based essential interventions for women, children and adolescents is the dominant set of agreed interventions guiding global policy. So please make her welcome.
All right. Good evening, everyone. Sorry I couldn't be there in person, but thank you so much for inviting me to be a part of the presenter for Dr. Brian Pridmore Perinatal Forum. In today's presentation, I'm elucidating the concept of perinatal health from a global perspective. This approach is established on the premise that the identification and comprehension of perinatal health challenges within culturally and linguistically diverse communities are inherently influenced by the unique experiences and multifaceted challenges observed in their countries of origin. An in-depth understanding of these contextual backgrounds holds paramount importance in the provision of effective healthcare services. I'll start my presentation with this slide describing the Millennium Development Goal 4, which had a target on reducing child mortality by 2/3. Yes, this has been done and finished, but I'm just emphasizing on this Millennium Development 4 target. The number of children dying under the age of 5 years presented on this slide is in millions. So by 2015, the world had indeed reduced child mortality from 12.7 million in 1990 to less than 6 million deaths in 2015. If we take the population increase into account over this period, the world had indeed achieved the Millennium Development Goal 4 target on reducing child mortality. But then the executive director of UNICEF, Anthony Lake, made this speech if this is a statistical victory or a moral defeat. He showed the world the ugly truths that hid behind these successes, and he showed to the world that there were tremendous disparities, and the people who were left behind were on the basis of poverty, ethnicity, conflict, migration, etc. A lot of people then did not understand what he meant by this, but then he explained what is not visible from this achievement is the progress in reducing child mortality amongst the poorest of the poor. But then it was too late, and this realization came when MDGs were concluded. So this indicated that there were many blind folds at the time when these MDGs were coined, crafted, and followed. But at least we provided the world with a newer lens at looking at the numbers when the progress is measured. In the current era of sustainable development goals, our approach to assessing progress has evolved significantly. Instead of solely focusing on overall progress of a nation or society as a whole, we now pay much closer attention to how different segments of the population are faring. These segments are defined by factors like gender, race, ethnicity, geography, and more. Rather than assuming that development benefits everyone uniformly, we recognize that progress can vary significantly across these different pockets of society. This global map provides a visual presentation of the progress made towards achieving sustainable development goals. Specifically, it highlights the situation in South Asian and Sub-Saharan African countries, where there is significant challenge in reducing neonatal, child, and maternal mortality rates. In these regions, the burden of deaths among newborns, children, and mother are particularly high. However, when we look at the map, we can observe that these countries are quite distant from reaching the targets set for 2030 under the Sustainable Development Goals. Now, if we look at the global maternal mortality, every single day, a staggering 800 women lose their lives due to the causes related to pregnancy and childbirth. And the tragedy is that these deaths are preventable. When there has been some progress within the maternal mortality rate, decreasing by approximately 34% between 2000 and 2020, it is crucial to note that the vast majority of these deaths, that is 94% of these deaths, continue to occur in low and middle income countries. The significant number of maternal deaths in certain part of the world actually underscores the disparities in access to high quality healthcare services and underscores the glaring gap between the wealthy and the less privileged. In 2020, the maternal mortality rate in low-income countries stood at a striking 377 maternal deaths per 100,000 live births, while in high-income countries, it was remarkably lower at just 9 maternal deaths per 100,000 live births. The scenario is not very different if we speak about stillbirths on a global map. While global progress in reducing child mortality has been remarkable and the global under 5 mortality rate has declined by almost 59% since 1990, the situation of neonatal and child mortality on the global map is similar to stillbirths or maternal mortality. So by adopting this additional perspective that were discussed after the MDGs were concluded, we can now discern the progress in more substantial in high-income countries when compared to low and middle-income countries. Likewise, the newer lens allows us to identify disparities in progress among different genders as well. While there has been some shifts in the leading causes of neonatal deaths, millions of precious newborns continue to lose their lives due to preventable causes, primarily driven by infectious diseases and premature birth. At the forefront of these challenges is respiratory illnesses, which tragically remain the #1 leading cause of neonatal mortality. But when we delve deeper and analyze the ranking of these causes of deaths in various regions, a notable pattern emerges. It becomes evident that the infectious diseases continue to be the primary culprit behind the high mortality rate, particularly in low middle income countries. But when we compare these ranking with high income countries, these are significantly very different. This map is actually showing the global distribution of double and triple burden of malnutrition, which is again very important for when we talk about perinatal health. You can see that the African countries are facing the triple burden of malnutrition, that is overweight, stunting, and anemia at the same time, whereas South Asia is facing double burden of malnutrition, that is overweight and stunting. Indeed, there is well-established connection between malnutrition and perinatal health. This specific graph demonstrates a clear correlation between the prevalence of stunting and countries' GDP per capita. In simpler terms, as a country's GDP per capita increases, there is a noticeable decrease in the prevalence of stunting, highlighting a strong connection between economic prosperity and child nutrition. Now, while there are medical factors to influence health and mortality outcome, the World Health Organization framework on social determinants of health outlines non-medical factors that influence health outcome. They are usually the condition in which people are born, grow, and work and age. And these also include wider set of forces and systems that shape the condition of daily life. And these include economic policies and system development agendas, social norms, social policies, and political system. Also, not to forget the conflict and humanitarian crisis that arise in some settings as well. And all of these have an impact on equity in health and well-being. While the increased focus on social determinants of health overall, the importance of social factors associated with maternal and perinatal health outcome has received wider attention, and that brought the existence of this framework, which shows how individual attributes, family and peer attributes, and intermediary attributes such as community and health services, and structural attributes shape the health inequality and maternal and perinatal health outcome. Now, the disparity and social determinants are actually impeding low and middle income countries from making progress in improving perinatal outcome. One of the study presented that out of 195 countries, 122 countries have already met the target set for Sustainable Development Goals, and 20 countries are expected to do so by 2030, which are marked in this circle in this small box. But there are 53 countries which are struggling to achieve the targets set for Sustainable Development Goals, and they might not reach the targets if intensified efforts are not made. Now, SDGs are directly related to social demographic index of the country. The lower the social demographic index, the lower the SDG achievement index, and vice versa. We all know that the need for better health and nutrition among mothers and children are recognized specifically in Sustainable Development Goal 2, which aims to end hunger, and Sustainable Development Goal 3, which aims to promote good health and well-being. However, improving health and nutrition goes beyond SDG 2 and 3 and is linked to each of the SDG that play a transformational role in driving sustainable development. Similarly, achieving health and nutrition depends on progress across many of the other SDGs, including those that aimed at clean water and sanitation, education, gender equality. So overall, everything is connected. One such example is the link between education and improved health outcome, both directly and through its effect on other determinants of health, such as income, employment, and living conditions. This figure is actually coming from a paper published in The Lancet, and it shows a dose-response relationship between maternal education and child survival. Similarly, a significant dose-response relationship between paternal education and child survival can also be seen. However, the survival is higher when mother is educated compared to a father. Talking about women empowerment, there is evidence that indicates that women's participation in household decision-making is associated with their and their children's health. One of the epidemiological study from Pakistan showed that less than 10% of women participated in decision-making. And let me assure you that the scenario is not very different in other developing countries where patriarchal setups, gender roles, and resulting violence have made women very vulnerable. This study also found that more than 60% of the time, unjustified beating to their wives was justified by their husband because of different reasons. So these factors actually limit women from exercising the decision on healthcare seeking for their own health and for the health of their children. Similarly, 1/4 of the world's women were child brides, specifically if they are coming from low and middle income countries. And early childbearing has significant impacts on perinatal health. Again, access to clean water and sanitation and hygiene are vital for survival, and it's concerning to note that the access of these essentials has declined over the years in rural areas when compared to the urban areas, but overall in low middle income countries, the access to clean water, sanitation, and hygiene is very limited. Conflicts have profound impact on maternal and perinatal health, increasing the risk and challenges faced by pregnant women and new mothers in affected areas. During conflicts, healthcare systems are often disrupted, leading to reduced access to essential reproductive health services. This destruction of healthcare infrastructure, shortage of medical supplies, and displacement of healthcare providers can further contribute to a decline in quality and availability of maternal and perinatal healthcare. Again, climate change is something which everyone knows that the changing climate pattern and extreme weather events associated with climate change can have detrimental impacts on the health and well-being of mothers and their children. One of the key concerns is the increased frequency and intensity of natural disasters such as hurricanes, floods, and heat waves. These events can disrupt healthcare system, damage infrastructure, and displace communities, leading to limited access to maternal and perinatal healthcare services. Pregnant women may face difficulty in reaching healthcare facilities, and availability of essential medication and skilled birth attendants may be compromised during and after such disaster. Climate change can also contribute to the spread of infectious diseases, which can pose risk to maternal and perinatal health through vector-borne diseases. Additionally, climate change impacts food security, nutrition, which have direct implication for maternal and perinatal health. So why it is important to understand global perspective for CALD population? This conceptual framework actually illustrates the role of the human experience of environmental change as a primary driver for migration and its potential consequences on health. To effectively address perinatal health within CALD communities, it is imperative to first gain a deep understanding of perinatal health issues prevalent in developing countries. These foundational knowledge is essential for providing culturally sensitive and contextually relevant perinatal care within CALD communities. And one such factor is to understand what are the evidence-informed effective intervention for that particular population. And we will be discussing those essential and evidence-informed interventions in some of the upcoming slides. One such work that I was fortunately involved was to prepare a list of interventions across the continuum of care for improved reproductive maternal newborn child health for the World Health Organization. That exercise actually reviewed 142 in total interventions and identified 33 very effective interventions that improve reproductive maternal newborn child health, and then it was translated into a WHO guideline as well. Some of the effective interventions are highlighted here in this slide, and that includes early initiation of breastfeeding, hygienic cord care, kangaroo mother care. It also includes some of the promising interventions like antenatal care, tetanus immunization, case management of neonatal sepsis, home visits across the continuum of care. Okay, now the research, as we all know, has dramatically expanded our understanding of how important is the first 1,000 days of life from early pregnancy through the first 2 years of life, and it is best known as a window of opportunity. However, it is also important to acknowledge that we have to go beyond these 1,000 days and focus on other life stages as well. For example, adolescence, which offers a second window of opportunity in which growth and development are faster than at any other time except for the first year of life. Now, this suggests that it is equally important to invest in adolescents because they are the future parents. So while considering perinatal health, it is important to consider adolescent and young adults in this agenda as well. It is important to intervene early to improve their health early on so that they have improved maternal and perinatal outcome later in life. Okay, again, with this notion of intervening early, we looked through the risk factors and potential interventions that can improve adolescent health, and later on, it can improve, the future generation and their offsprings as well. So we undertook an evidence synthesis exercise, and we identified interventions that are plausible and robust for inclusion in programs and scale. And these all interventions, evidence-informed interventions, are coming from the literature or studies that have been published and the studies that have been conducted in low and middle income countries. And these include preconception nutrition supplementation, micronutrient supplementation, sexual health education, prevention of pregnancy in adolescents, nutrition supplements for pregnant adolescents, and so on. We also identified some interventions that are highlighted in blue, which requires further research, but are important to be included in the program for improved maternal and perinatal health, and that includes prevention of obesity, vaccination coverage, prevention of substance abuse, treatment of mental health issues, and so on. We also identified some of the interventions that are highlighted in the red boxes, which requires a lot more further research. We also know that the preconception health is very important because this is the continuum of care approach, highlights the importance that improvement in health should be started early on. And with this thought in mind, we actually look through the evidence on preconception care intervention. Now, preconception care intervention bridges the gap in the continuum of care and addresses pre-pregnancy health risk and health problems that could have negative maternal and fetal consequences. Within this framework, some of the categories for preconception risk and interventions were developed. So we identified some underlying, intermediate, and immediate risk factors that can have an impact on the mortality, morbidity, and disability. And intervening on these different risk factors can improve the health of mothers and babies. So a list of different interventions have shown effectiveness in improving the health of mothers and babies. And these interventions are bundled together and highlighted in this slide, which includes, the screening and management of chronic diseases, nutritional optimization and obesity prevention, a simple generic youth development programs that includes infection prevention, specifically STIs and HIVs, nutritional counseling and family planning, or the uptake of contraceptives. So this slide is actually showing all the different protective and risk factors across the life course and where exactly and how exactly different interventions can be provided to improve the health of mothers and children, specifically those who are in disadvantaged settings. So we all know that 99% of all maternal, newborn, and child deaths occur in low and middle income countries. So increasing health resources and appropriate interventions in these countries is an urgent priority and global responsibility for reducing the burden of maternal and child mortality. So we looked through some of the strategies. There are some very simple strategies that have shown an effectiveness in improving the health of mothers and babies. And one such strategy was community mobilization. A simple community mobilization or awareness can have a big impact on improving the health of mothers and baby. And one such systematic review identified that community mobilization or awareness activities in communities can reduce neonatal mortality by 30%. When community mobilization was bundled up together with home visitation of community health workers, it showed that 29% of all neonatal mortality can be reduced. Similarly, this simple strategy has a potential of reducing stillbirths and perinatal mortality by 22%. This very same simple strategies have shown effectiveness in improving in the uptake of institutional birth by 20% and initiation of early breastfeeding by almost 93%. So the work that I have done in community health workers have shown that community health workers do provide a wide range of services in communities, and services offered by community health workers have shown reduction in maternal and neonatal mortality. So achieving SDGs targets in countries where the progress is very low and countries with the very fragile health system and economic system, community health workers does play an important role in improving the health status. I think with this slide, I'm ending my presentation, but it is important, and I should be highlighting this again, that it is important to recognize that perinatal health issues within CALD communities may be influenced by the experiences and challenges that they bring from their country of origin. So understanding these background is crucial for delivering effective care in the host countries. I would also like to acknowledge all the different, funding organization and donor organization who have helped me in doing the work that I have done so far. Thank you.
I just wanted to ask what community mobilization is, or an example of community mobilization.
So community mobilization actually includes providing door-to-door services where community health workers usually, either visit the house of the mother, or they prepare a group where women come and attend a session, and they just provide awareness about, maternal health and how to take care of a woman during pregnancy, what to be done when the childbirth is near, why it is important to have antenatal care, and how the nutrition can be improved, how to care for a child, those kind of awareness session that they provide in community.
Hello, I'm Shirley Kwen Ying Chen, one of the midwifery educators for Women's and Children's Hospital. Putting my educator hat on, this is really inspiring. What do you think are the key gaps you might see as clinicians from Australia, the initial gaps of to provide culturally safe care? Do you think is providing them this background of information for them to have some reflection at the start, to start them off knowing the gaps? Because I feel like when we go to university or when we provide education about cultural safety, we were never provided this basic information about health well-being as a whole, and what the barriers that culturally and linguistically diverse consumers might face in their own country. Do you feel like that is a good starting point for education for cultural safety?
Yes, I would say thank you for the question, first of all. Yes, it is important, but it is also important to understand where they are coming from, just to realize what they have faced. I mean, usually the factors are very similar across low and middle income countries. I'm a migrant myself. I'm coming from low middle income country myself. I know the challenges that we face. So the challenges are actually very similar across all these countries, but the value system and the cultural system is little different. So it is important to understand what is sensitive for them and what is not sensitive to them, and how to deliver that information. It is something that we need to understand and recognize how some of the education needs to be delivered to them and how they would take it.
Thank you.
So we've just got a question through the chat. How can we improve health outcomes for mother and children as mental health workers?
I think it is again very similar. It is important for mental health. Again, someone coming from different country, they are facing a lot of mental health challenges, trying to establish themselves in the new country, understanding the system, understanding the language. They are going through a lot of different, changes. So it is important to realize that. And then I think for any intervention or any awareness that you deliver, it needs to be co-designed. It is important to understand from them what they require and then deliver accordingly. It is very important. Co-designing is very important. Engaging with them is very important. Yeah.
Anything else? Okay, so if you can all join me again in thanking Zohra.
Thank you.
Thank you. Thanks so much.
Bye.